guys, welcome back to my channel. If you're new here, I'm Dr. Jimmy Anita. I got a score of 217 in June 2021 FMGE exam, and many of you had asked for important topics for December 2021 FMGE exam. Before watching this video, please go through the study plan that I gave you. Link is in the description. This is purely based on my personal experience, and I also referred few sources. I cannot guarantee you all that if you study only these topics, you will be able to crack the exam because, as you know, the question paper is framed in an unpredictable manner these days. So just have it as a checklist before going to December 2021 exam. Let's get started.
First, let's talk about obstetrics. I've given you the important topics as well as the subtopics. I've also highlighted the high yield topics which often get repeated. So don't miss them. Also, take a screenshot of all these things. Let's get started. First, postpartum hemorrhage and then placenta, RH incompatibility, twin pregnancy, molar pregnancy, gestational trophoblastic diseases, antepartum hemorrhage. Pregnancy-induced hypertension, gestational versus overt or pre-existing diabetes mellitus, intrauterine growth restriction, cardiovascular disease in pregnancy, abortion, preterm labor, and labor. The single most important topic is labor. Know everything about labor. Female pelvis anatomy, don't study everything, pay more attention to only diameters of the pelvis, contraception and sterilization techniques, surveillance, antepartum as well as intrapartum surveillance, ectopic pregnancy. Let's talk about gynecology now. Menstruation, PCOS, ovarian hyperstimulation syndrome, tests for ovulation, endometriosis and adenomyosis, fibroids, their types and management, cancer staging and management. Pay more attention to cancer of cervix, pap smear and visual inspection of cervix with 5% acetic acid, cancer of endometrium, cancer of vulva and then cancer of ovary, abnormal uterine bleeding management, Mullerian abnormalities, imperforate hymen. Uterine prolapse and stress incontinence, pelvic inflammatory disease, infertility, pay more attention to male infertility, vaginal infections, amenorrhea and intersex. Let's talk about PSM now. Epidemiology, know about the cohort, case control, randomized control trials, clinical trials and everything. Know about the types of epidemiological studies basically. Know the difference and know which one is better than the other. And then health and disease, and then vaccines and cold chain. Pay more attention to national immunization schedule and cold chain maintenance. They are very, very important. Preventive obstetrics, pediatrics and geriatrics. Know about the number of antenatal visits. School vision screening, school health is very, very important. Demography, demographic cycle. Know India is in which stage. Also know the values like total fertility rate and everything. Know about screening, pay more attention to lead time as well as national health programs. Know about the screening and diagnostic tests of different diseases like TB and cervical cancer and everything. Nutrition and health is also very important. Social sciences, pay more attention to Kupuswamy socioeconomic status scale. And also know the values in health economics. Know the definitions, not values. And from the chapter of environment, pay more attention to water chlorination as well as medical entomology. They are very, very important. And from international health, know about World Health Organization, UNICEF, International Labour Organization, Food and Agricultural Organization. Know the logos of all these organizations and pay more attention to health communication. Know the pictures, be thorough with the pictures. Healthcare system, the 3 levels. The single most important chapter in PSM is healthcare system. Know everything about the healthcare system in India. Family planning and contraception, know all the values as well as the different contraceptive methods. Look at the pictures of all these barriers and diaphragm and vaginal sponge, IUDs, everything. And then comes health planning. Know about Board Committee, Jangalwala Committee, Kartar Singh Committee, Srivastava Committee and everything. Pay more attention to PERT and CPM, critical path method, as well as cost effective analysis. Allied health disciplines, biomedical waste management is the single most important topic. Every year, sure short question is from this topic. Communicable and non-communicable diseases, biostatistics, you'll have some numericals from this chapter, at least one or two every year, so pay more attention. National health programs of India and major schemes and initiatives. I do not have to tell you the importance of this chapter. Everything about this chapter is very, very important. Please don't skip them. Be thorough with everything. Now, let's talk about the important topics from pathology. So, let's start with general path. Do cell injury, inflammation, immunity. Look at the different diseases from the immunity chapter, immunodeficiency diseases, as well as pay more attention to amyloidosis. And then comes the most important chapter of pathology, it's hematology. Every year you get many questions from hematology. Pay more attention to this chapter. Please don't skip this. Do the different types of anemia, nutritional deficiency anemia, hemolytic anemia, bleeding disorders, leukemia, Hodgkin's lymphoma. Everything is important. Neoplasia is also an important chapter. Pay more attention to tumor markers. And then comes genetic. Do the diseases I have given you. And then comes systemic path. Do all the diseases I have given you. Don't skip anything under nephrotic and nephritic syndrome. Know all the diseases. Let's talk about ophthalmology now. Do lacrimal apparatus, congenital nasolacrimal duct obstruction. There was a question in June 2021 FMGE exam. Know about probing and syringing, cataract, everything is important, glaucoma. Know about the visual field defects. Know the difference between open angle versus closed angle glaucoma. Uveitis, pay more attention to anterior uveitis and all the signs that you would see. Sympathetic ophthalmitis, refractive errors. Know the different types of refractive errors. And retina. Know about the retinal detachment, different types of retinal detachment, as well as vitreous hemorrhage. And know the causes of cystoid macular edema. If you're going to do ocular cancer, do retinoblastoma. And then comes neuro-ophthalmology. Know the visual pathway. For example, if there is macular sparing, you have to know that it's a problem in occipital cortex. Know the different types of squint as well as the tests like cover uncover test and everything. Pay more attention to the pictures for cranial nerve 3, cranial nerve 4 and 6 palsies. Know the signs of each and every palsy. And then comes conjunctiva. Pay more attention to WHO classification of vitamin A deficiency. Look at the picture of pterygium, it's very, very important. Trachoma. Know about Vision 2020. And then comes cornea. Know the different types of corneal ulcers, bacterial, acanthamoebic, viral and everything. Fungal ulcer. Know the characteristic finding of each of the ulcers. And finally do ocular trauma. Pay more attention to the bucket handle sign and vitreous hemorrhage and iridodialysis and everything. ENT, ear, nose and throat. Let's look at the important topics. From here, do malignant otitis externa, otosclerosis, Meniere's disease, vestibular schwannoma, and know the different types of hearing implants. From nose, know allergic fungal rhinosinusitis, cancer of maxilla, CSF rhinorrhea, and different types of nasal polyps. Know about juvenile nasopharyngeal angiofibroma, nasopharyngeal cancer, membranous tonsillitis. From pharynx and from larynx, juvenile papillomatosis, cancer of larynx. Also know the procedures, tracheostomy, cricothyrotomy. Let's talk about psychiatry. For small subjects, I advise you all to read everything because syllabus will be limited. Do the important topics only if you have absolutely no time left. Let's start with the important topics. Pay more attention to mental status examination, delusion, different types of hallucination, the criteria for hallucination, and know what is pseudo hallucination. Psychosis versus neurosis, know the difference. Know everything about schizophrenia, know the typical versus atypical antipsychotics, know about the side effects. Delusional disorders, depression, pay more attention to the signs and etiology. Bipolar disorder, treatment. Personality disorders, know all the clusters. Anxiety, panic disorder and phobia. Obsessive compulsive disorders, know what is obsession, know what is a compulsion. post-traumatic stress disorder, somatoform disorder, so dissociative disorders, Munchausen syndrome, know the definition, substance-related disorder, pay more attention to alcohol, it's very, very important. Know the, time limits for withdrawal symptoms. Eating disorders, sleep, sexual disorders, attention deficit hyperactivity disorder, intellectual disability. There has been a question from this recently. Know the difference between delirium versus dementia. Pay more attention to Alzheimer's disease. Let's go to dermatology now. Dermatology is all about images. Please look at the images again and again rather than focusing on theory. Let's talk about the important topics. Layers of epidermis, know the different layers. Nail changes, know about the pitting. Hair disorders, alopecia areata, androgenic alopecia. Know how to differentiate between the hair loss of alopecia areata from trichotillomania. Blistering disorders, everything about this chapter is important. Bacterial infections, pay more attention to impetigo, ecthyma, as well as know how to differentiate between erysipelas and cellulitis. Fungal infections, know the different type of superficial fungal infections and deep fungal infections. Know the, in fungal infections, know the characteristic changes that you would find under KOH mount. Pay more attention to lupus vulgaris, lepra reaction. Recently, there has been questions. The diascopic finding of lupus vulgaris, that is apple jelly nodule, look at the picture of that, and also pay more attention to sexually transmitted infections. Know everything about this chapter, it's very, very important. Know all the different types of sexually transmitted infections and the characteristic findings of the ulcer. Then learn about psoriasis and lichen planus. Look at the histopath findings of these both diseases. They are very, very important. And then pityriasis rosea. Know what is a herol patch. And then do melasma, pigmentary disorders like melasma, Becker's nevus. Look at the image. This has been repeatedly asked. And then vitiligo. I think there was a question about segmental vitiligo in June 2021 FMGE exam. So pay more attention to that. The last subject for this video is anesthesia. Let's just look at the important topics which have been repeated from anesthesia. The pharmacology of anesthetic drugs is the single most important chapter. Pay more attention to inhalational agents. Know the characteristic properties of each drug. Know which one is drug of choice. IV anesthetic agents, neuromuscular blockers, know the difference between depolarizing, non-depolarizing neuromuscular blockers, local anesthetic, know what is last, that is local anesthetic systemic toxicity. And then do airway, look at the images of basic airway devices, LMA, ET tube, Mapleson circuits. Anesthesia mission, know the paths, monitoring, abnormal graphs of CAPNO is very, very important. Know about ASA grading as well as Mallampati classification, look at the images. Know about nil per oral orders, and then central neuraxial blockade and the complications. CPR is very, very important. Every year one question from CPR is must, so please don't skip that. Know about BCLS and advanced cardiac life support. That's all for today, guys. I'll try to upload the remaining subjects in subsequent parts. I think I would need 2 more parts to complete this. This is part 1 of the important topics.
Part 2 will be uploaded soon, and that will include all the remaining subjects. If you have any queries regarding FMG, you can leave it in the comment section below. I'll be happy to help you. And also subscribe to my channel for more such videos. Bye guys, happy studying.